Hello, this is the Influential Dental Podcast with my dear friend Julianne O'Connor, and we have a wonderful guest today and a dear friend of mine from many years ago, from my days at Noble Biocare, and very much look forward to talking with Dr. Ana Ferro all the way from Portugal, and really do appreciate you being our podcast today. Ana, I just want to give a little bit quick bio. It's long, so I recommend everyone go check her out at anaferro.com. But again, it is an amazing journey and look forward to hearing more about it. But you're currently at the MALO Clinic in Lisbon, Portugal. You teach, you do surgery, you're the head there. You also do lecture internationally, and just an amazing story. So could you just share a little bit more about that and kind of your journey, and then we'll get off and talk a little bit some of the questions that we have.
Well, my journey has been for me, I think, pretty simple because I started to study my graduation actually at a German school here in Lisbon. Then I started to study. I didn't know what I wanted to study. Actually, first I wanted to study medicine, but I didn't have the grades to enter the university. Basically, dentistry chose me, so I went to dentistry. And the first years were actually with the medical school together, and it was a surprise for me. I really enjoyed it, and then I stayed. I never wanted to change. So usually I say that dentistry chose me, not that I chose that I've chosen this profession. So it's nice. So this was the beginning of it all. Then through university here in Lisbon, well, basically always my favorite subjects were perio and surgery. And then after I graduated, I joined the MALO clinic in Lisbon, where everything, well, 20 years ago, where everything was, the All-in-4 was booming, was actually gaining their own way and their own space. It was very controversial at the time, but so I stayed immediately. I joined the Paulo Malo's team, and I worked next to him every day for many years in surgery. From there, it was basically automatically that I started also to lecture about this subject, and that I had a huge connection with the industry. So this was very normal, and one thing after the other, it was automatic, so to say. From there, basically, I joined the Noble Care world, being a key speaker and getting involved also with many of the activities that they have, also helping the Foundation for Rehabilitation, also getting inside the women's community and trying to inspire other women. And at the MALO Clinic itself, we had a lot of education. So this was very easy.
Yeah, I love it. You know what? And by the way, Mike just forgot I was here today. Usually we introduce each other too in the beginning of our podcast. But hi, I'm Julianne O'Connor, Mike's co-host some of the time, apparently. Anyway, and Dr. Ana Ferro, it is so awesome to have you on the show. And you have obviously this extremely extensive background. And on Influential Dental, we sort of dedicated this podcast to really lifting up influencers in the space who are lifting others up with them. And so you've been out there lecturing. I met you at a party. And
Yeah.
so, you know, and you were such a joy and such a light at a party that was massive, packed full of people. You stood out like the light above all the lights. And it was so much fun getting to kind of know you just a little bit, scratching the surface, just knowing that you're our people. Like you were said, we have to collaborate. We have to do something. Come on. So tell me, what is it about you that has allowed you to, over this incredible career, to maintain that level of energy? I know you do a lot of different things for balance, but you have this incredible background. You're out there lifting people up. You're helping people. You're lecturing. You're doing all these things. Like, what is it? How do you have sustainable, never-ending energy? I'm curious, and I want some.
Well, I think that has to do a lot. Also with me, I'm very lucky genetically. I don't know, but I'm lucky because I always have been a happy person. I think maybe I was a little inspired by my mother that always saw the good things, even when there was a problem, even if it was, imagine, raining and a bad day, we say outside, "Oh, it's an amazing day to stay at home and watch some movies and just eat some popcorn." So always try to see the good side of the story. So I think I was influenced by that since I was very, very young. Second, I think I am surrounded by many good people, including family and friends, that give me always this safe harbor. So all my friends, my closest friends, I know them, I think, for more than 30 years. So they know everything from me. They know how I grew up, the difficulties that I have. So it's very easy. They know me from A to Z. They know everything and they accept me as I am. If I was, I don't know, working at a coffee shop or being the greatest, being a president of our countries, they would love me the same. So this is to say that I have a very safe harbor. So for me, it's easy. I don't risk a lot, because for me, the most important things that I have can't be taken away so easy. You understand what I mean?
I love that.
Yeah.
I love that. So not only, and I know, Mike, you've got some incredible questions, I'm sure, coming to mind, but it's funny because a lot of people didn't grow up with somebody with that perspective. So what would you say to somebody? And I grew up with that similar thing. My parents were hippies. We had nothing, no plumbing, no nothing. We had no money. We were killing rattlesnakes for food. I mean, it was ridiculous. But my parents had a way of always teaching us to just look for the magic and all of that. And we had no idea we were broke and poor. And so what would you say to somebody who actually doesn't grow up with that sort of view? They've maybe gone through, hard times. You've obviously gone through hard times too, right?
Yeah.
Yeah, because people
Yeah,
think,
of course.
yeah, because people look at people who are very successful and sometimes they think, oh, well, they didn't really have to overcome something major. I presume you've
No,
overcome
I
some
think
major things.
yes, of course. I think that
Yeah.
that everybody on their own story has different situations that they have to deal with. The thing is the way you deal with that situations and the importance of them all. And I always say that from the bad times are actually from where I learned the most. You understand? These hard times, the good times, you just pass them by, you enjoy them. But of course, you also think about them and you are grateful for them and you learn to be grateful and all of this. But the hard times, they make they make you change. They make you stop. They make you think about it and react. And you have to react. So the thing is, don't look at a bad situation or a challenge as something that it's bad. Look at the challenge on something that you will learn from and will improve from that. And that's all what I always say to my kids, and that's the importance of it all, because they have to have challenges, they have to have difficulties, because if you give everything to them or you overcome their obstacles, then they are not growing to be strong. They are going to be very weakened. So this is what I want to say. But I think I always saw all the difficulties as challenges, and from the challenges always will come something great. And this is the way we always look at dentistry, because always between our team, this is just an analogy, has nothing no different, but it's the same. Every time that and that we have a problem, we don't face it as a problem. We face it as a challenge and something that we have an opportunity there to change, to create a tool or to develop a protocol or to create some kind of process where there can be space for evolution, and that this has always been like that since I entered the dentistry world. So it's been amazing.
So I love, yeah, I love your story. I love your advice. I love what you're saying on so many levels. Mike, I'm going to let you jump in for a minute, and then I'm going to definitely have some more questions.
Yeah, no, I wanted to go back a little bit regarding what Dr. Ferro said. Obviously, the MALO Clinic is very influential in dentistry, and Paulo Malo, the inventor of the all-in-four concept, and everyone who does full arch dentistry knows what the all-in-four is. And so Dr. Ferro has been on the cutting edge of that, teaching it, leading it, and being an expert there. But what's also amazing, like you, Julianne, and obviously women in dentistry, is you do have to balance a lot of things, right? From motherhood, which we both know you are working mothers. You're all both very successful. You lecture, you coach, you teach. So I guess for you, Dr. Farrow, is what is your key to being able to juggle all of that, to be the best of the best as a surgeon, as a lecturer, as leading the clinic, but then also as a mother. And what are your thoughts on that?
I think it's something that obliges me to have to do a lot of work, daily work, which means that in a sense that it's a work that I have to do consciously uh, for myself in terms of physically and mentally, because I have to basically I'm every day on a way to discover myself better and better. And I think it's very important for me to have my space to do my sports where I can clear my mind, where I can feel my body, but also to have time to meditate a little bit, to breathe in, to feel everything. You understand? Because sometimes it's too many things, and usually I say I don't want to be the best in anything. I just want to be good in everything.
You're more than good at everything. So that's you're being very humble.
I wanted to say over the weekend, my husband and I were like looking at, some of our gurus and some of the people that we really admire and who their mentors were and what the advice was that they had passed down to them. And one of the pieces of advice that I heard was that somebody had told one of our gurus that don't do everything, diversify. Most people are saying you need to focus on one thing. But this guru actually said to another guru, do everything, experiment and play with everything. Why not?
Yeah,
And
yeah,
I thought, that invites a lot more failure, but you learn so much more as well. And if you look at great entrepreneurs, they make a lot of mistakes, but they
of
excel
course.
much faster than the person who just focuses on only one thing. So, anything about that? I mean, I love that you're saying that, yeah, why not be good at a bunch of things? And obviously
Yeah,
you're
because
great too.
because I think it's all well. At least I want a lot of things, you know. I want a lot of things from life, not just about work, not just about the career, not just about family, but also to have to help others, you know, and to really make a difference. And when you want all of this, and you have to have this balance, well, you have to focus on many things, and so you have to be very, not that I'm very organized, but I have to have time for everything, you know. And so I end up to have to be organized in that. So you have to be organized with your scheduling, and sometimes you have to do the things that you don't want, but you have to commit yourself, and this is very, very important. So I think for me, one of the just not it's not just the work, see the patient, see how you can improve, but then it's also how to develop, to see what challenge do you have, what can we still get better in the dentistry field. So work on that as a team, and we are very lucky at MALO Clinic to have that research department where we can move forward. So everybody's thinking usually what kind of problems we have. So the problems for us are actually our light to move forward. And then I think it's very important that we write everything down, that we publish, that we share with the community to make this difference. I also, one of the things that gives me more pleasure is to be able to teach others everything that we already know, so they don't have to go from the same mistakes that we had in the past, so they can start from the level of knowledge that we already have. So sharing with everybody, because there will always be problems, and will always be other challenges in the future. So I think this is for me very, very grateful that I am able to have this opportunity to share with everybody the knowledge that we have and how things are done. And also the majority of the times I also learn from everybody, which is great. But this is the
Yeah.
way that we can actually allow more patients to have better treatments, you know. And at the end, when you teach one of your peers, then you are maybe changing the life of many patients. And at the end, that's the most incredible thing of it all. It's great.
Yeah.
What's the culture like at the Mellow Clinic? Like, what's the culture like? What's the vibe? What's the energy? Curious, and do you have a
It's
lot to do with that?
Well, yes, I think we are like I think we are not very young anymore, because I'm there already for 20 years, but I think it's the same atmosphere when I entered because at the beginning, imagine we were doing something that was criticized all over the world, that all of my professors and everybody I knew, that I read the books, was criticizing and say it wasn't possible. But I could see with my own eyes that it worked. And how it changed the patient's lives, and from actually from one day to the other. And so this was incredible. But from the beginning, we felt that from 1 year that I was in university, and you have this, okay, you have to do like this because it's written to do like this, and you have to follow the receipt, suddenly to a world where everything was possible. Okay, you read that, it was okay till that time, but you can put that into consideration. You can try to evaluate for yourself if you think that's correct or not. And how can you improve it? How can you change it? Because the truths that you have in one time are not so truth in the future, are the lies. So, and maybe the truth that we have now will be completely, in 20 years, will be other things. And I'm here to learn. And this is amazing, because in the world of dentistry, you don't see a lot of people that actually will change their mind, or will able to have this flexibility to change the mind over the years, and to be able to continue to learn, and to stay humble. I think in that I'm very inspired by Professor Thomas Albertson. He's one of a kind. He's amazing to talk to. You should have him here, because he's amazing. And the stories that he tells about the works with Professor Brainmark, and all the beginnings, and what they thought, how it was, and the papers they wrote, and what they wrote in the discussion. And suddenly some of the proposals that they were written then were assumed as completely truths, and how he changed his mind to now to the theory, and not theory, of the anti-inflammatory reactions with the implant placement, and the healing of the implant, and all that balance. I think it's incredible, for someone who is able to always stay, but with their mind, okay, maybe things that I thought were true at one point of time, because we don't have microscopes, or because we don't have any kind of tests, are able to have this flexibility to change the minds in the future. And so I pray that I continue to be like that, continue to learn a lot.
Yeah. And I want to reiterate what Dr. Ferro said about Dr. Albertson and Dr. Brandemark, and all the, obviously MALO Clinic, and with Paulo Malo, and Anna, you and your colleagues there as well. Just continue to take that and elevating it and teaching it, and not backing down. And I love what you said about anything or everything's possible, right? And I think you're right. Not only the procedure, but more people getting the treatment, more doctors being willing to learn, to explore. What you're doing in mentoring, what you're doing, like I said, in women in dentistry, and just thinking outside the box, and thinking about that, everything and anything is possible. And Julianne and I are seeing that now with what we're doing with Influential Dental, that you can be influential, you can help others while you help yourself and help the patients. It's not a transactional, you win, I lose, or vice versa. No, everyone can be uplifted, and ultimately the patients can benefit. And I know you've said that earlier as well.
I think that maybe that's what makes the difference also between the way we think, and the way, and why it has been so successful. It's because I think that you have a big number of teachers in dentistry that like to give the recipe of something to be very complicated. You do A, then you do B, then you do C, then you come to A, then you do very complicated, and then you end up like, oof, I can't do this. Oh, this is very complicated. And our goal was always to try to simplify as much as possible, to give a protocol that everybody all over the world, if you give the protocol and say, first you do this, then this, then this, then this, then this, would be able to be done, to be performed by many dentists all over the world, many normal oral surgeons, but that had good experience with dental implants, they would be able to do this. And we are talking about a kind of treatment that before people had to go through hip transplant, then 8 implants, then no loading, then they had to wait. So it was not about it's not about if you can do the graft or not do the graft. It's about the patient, And if it would be a procedure that would be shortened in time, would be of course less costly to the patient, but would have imagine that had all this advantage, but the failure rate was bigger. Forget, we would never go. But the success rate is even better. So at the end, it was about trying to simplify everything and to make protocols so that everybody could be able to perform it. You
I have a
understand?
question on that. So
Yes.
you guys are teaching Zygo, you're teaching All on Four, you're teaching all of it. And one of the things that comes up a lot has to do with the confidence, right? So I get simplifying the protocol makes absolute sense. But what happens when you still have people, whatever, 75% of the people are still lacking the confidence? They think, yes, this seems simple, but they're still afraid to pull the trigger and try. How do you encourage them to take that leap of faith?
I think that it depends. It depends on where they are and what they want to do next. I think one of the things that we always do is to come for education, of course, to have our courses where we have also not only courses that are theoretical courses, but then we have hands-on on models, and we have hands-on on cadavers. And also we were performing a course also in Brazil that was possible to actually to be with us and perform on patients. So even if they are still not comfortable, they can always have a mentor with them when performing the first surgeries. So I think that we try to give all the resources for them to feel safe, because for me it was always very easy because I had a big team working with me. I remember my first case of All on Four. I was at the clinic already, I don't know, for a year, and in 1 year I had already opened and extract teeth and all of these, many All on Fours. We were doing by that time, I don't know, 10 a day or something. And what happened was that we had a Spanish course. So we had I think it was four Spanish people there, and they were with us in the OR. And basically I started to do the surgery. To open, I would raise a flap, I would extract the teeth, etc., and I would wait for Dr. Malo to come to do the surgery because it was a course, etc. But then he was taking too long, and I continued to explain. So we'll start in the middle line, we place the guide, blah, blah, blah. Then we started drilling. So I was telling everything, explaining everything, and explaining to myself, So I drill all the drilling and everything. My first All on Four, I performed live to other people, for other people to see.
I always say we teach what we need to learn, but that's like being put in the mix.
No,
Go
it
on,
was
that's
unbelievable
so funny.
because then I was stitching and doing the impression, and Paulo came to the room and said, "Who did the All on Four?" And I said, "I did." And then Paulo said to the Spanish guys, "You know how many she did already?" And no, it was her first one. And the guys, every time we are in the Congress together, they say, "We were the first ones with you." And I say, "Yeah."
That's amazing.
But it was amazing.
Well, you have the confidence to do it. You have the confidence. You just jumped in. You didn't know better. You're like, who's going to do it? I'll do it.
Yeah, exactly. And I had my back completely. If something went wrong, I would just stop and he would continue. So for me, it was always very, very easy. So I appreciate and I know the importance to have a team with you. So what I always say is feel prepared, do all the courses that you need to, not jump like kamikaze thinking you know everything. And find a mentor that can be with you, that can discuss with the case with you before, after. Nowadays, with the digital world, it's very, very easy to discuss where you want to place the implants, everything from planning to surgery to the prosthetics. It's very easy to share all these files and to have a good discussion, even if you are not next door. So it's easy. It's very easy.
Yeah, I'm curious. And then, Mike, I know you've got something else, but really quickly, do you visualize the end result when you go into surgery? Are you like going in with any sort of visualization? You know how high achievers in
Always,
sports or anything else, they're visualizing right ahead of
always,
time. Okay, that's great. Thank you,
always.
Mike.
Not only I visualize I visualize in my head always, but that's for all the patients, all the process before, I do this. So I visualize everything. So everything goes very fluid, you know, and quick because I have this visualization before. And also, I always also have, but this is already automatically, I always have already a plan B and plan C. If something, I know the spots where something can go according, not also depend on me, but how the bone reacts, if it's going to expand, if it's very soft, if it's going to, if it's harder to get good primary anchorage, so I always have a plan B, plan C automatically already in my head. So it's interesting. Yeah.
Yeah. Well, and you mentioned your team, and obviously, dentistry and especially full arch dentistry is a team sport and in general. And Julianne's done a lot of training and coaching regarding the mindset of the dentist and the team versus just actually doing the procedures, right? So I guess this is, I guess, a two question is one about the team, the importance of the team, but also about the mentality of that team in the patient interaction and to overcome any objections or to help the patient out when there is a failure or there is a problem. So I guess the mental side of what you do and your team and a little more about your team.
Yes, I think my team. Well, we are about now 5 surgeons. We are about 20 prosthodontists. Just for oral hygienists, we have in Lisbon like 18. So we have a big team. But it's a team that I think maybe the youngest one that is working there, it's now have been 9 years, the others are already, some of them 25 years working there. So the majority of us came straight from university to the clinic. That's the first thing. So we continue to grow at the clinic, and we learned a lot from each other. Many things that I learned, and I was inspired by my colleagues. And by that time, you cannot imagine, because it was a really big excitement, because we had people coming from all over the world, not only the patients to be treated, but everybody to learn from us, and you have witnessed it. So you can imagine, I remember being 2 months at the clinic, and we had the group. I don't know if it was Chinese. I think it was Chinese doctors. And suddenly Paulo Malo was just giving a lecture. And after some slides, he was tired and he said, "Oh, my colleague Anna will continue the presentation." And I said, "Well, I have to jump and I have to continue." And that's it. So we were used to do this from the beginning, to do live surgery, to present, to be among others, to explain, and this gave us a sense of teamwork between the team, where everybody was also very recognized and very excited, and we always were looking about, if we had a problem, how to fix it, how to overcome. So everybody would come with an idea, and some of these ideas nowadays are products, So it's very interesting, because sometimes, and we would stay long hours, because we had a thing that the patient had to leave with fixed teeth in the same day. So sometimes it was at 2 a.m. and the next day at 7 a.m. we were again there all together, and we were working like 6 days a week. So it was many, 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 many hours together, but we were all, yes.
I just think that that's like a powerful example of, when you have a common purpose, that there's
Yeah.
something where you feel like you're willing to do that. So I see that in entertainment, where you're working on a film project, you're working ridiculous hours and nobody complains. And
Yep.
it's really different from your usual 8 to 5 type of environment, right? And this is like, we're all in, we're all committed to this, whatever. And I laugh that you got kind of thrown in, but being thrown in also means that you're trusted. And so there's a way
Yep.
that we rise to the occasion, right? And I think about how many times Mike has thrown me under the bus to have to carry things. No, I'm half kidding. We both do that to each other. Mike will take over from here. I'm going to do that at the end of the podcast. I'm going to just hop off. No, anyway, but I love this concept. And we're always, because we do elite team training and we do that for group dental practices where you're trying to scale it and have significant impact, right? And so much is about enrolling people in this commitment, so to speak. Did you guys ever identify that as, hey, we're doing this together, we're coming together, we're committed? Or did it just kind of unfold that way? I'm just curious, like, do you guys talk about that? Is that part of your value set or your mission, or it's just evolved?
I think we talk about that, of course, all together. At the beginning, we didn't talk about that. It was just evolved. We were like just the kids who finish university, and we all love to work with each other. Basically, we would come to the clinic because someone would recommend us. So we were completely connected to each other. That was also very important. Our former professors at university. So imagine when I also teach at the university in Lisbon for 20 years. So I recommend many of those who now work at the MALO clinic. So we were basically very connected to each other. So we would help each other a lot. We would protect each other, so to say. So if one couldn't do something, the other would back him up. So this sense was always great. Nowadays, I think we look back and we realize what this came as a result as values that we have nowadays, because we continue to live this spirit. I think now the entering into the digital world is also a big part of it, a big demonstration. So we have created our own workflow, digital workflow. Didn't publish this one yet, so I'm not going to reveal. But it's very interesting because it has been a result of everybody giving also their opinion, trying to improve this, also how we can improve, how can I help you in the surgery. So it's always nowadays, I would say that this is a value of the company, of course. And in terms of mission, we have this mission because also not only the mission in terms of creating and simplifying things in terms of dentistry, but also in terms of value itself, in terms of economical values that we start to bring in terms of patents and in terms of other things that we might bring into the table. So this is very interesting.
Yeah. Well, obviously, you've worked very hard. You're very accomplished in dentistry, but I want to talk a little bit about your family, because we're not just all clinical. We also want to talk about things that are outside dentistry. You can share what you want, as little as much about your family, your children. I want to hear a little bit about your surfing. I've seen you dance, so I know you can dance. But let's smile and laugh a little bit. Tell us a little bit about your family and some of your fun activities that you do outside of working hard, because I agree with you. You definitely need to have a balance. You should get out there,
Yes.
Jump on a surfboard and ride a wave, or like you said, spend time with your family or anything you want to do. So please share with us a little bit about your family and some of your activities.
Well, I have two kids, two girls. One is 13 and the other is 11. They are both amazing kids. My husband, we've been together for 27 years. That's also, well, since we were 18.
And so is there a secret? Is there a secret there
Yes.
are you in a happy marriage or?
Yeah, no, because I think this is something for me that I'm a very happy. I'm in a very happy marriage,
So we
My
want the
husband is
secret, everybody.
beautiful. I don't know. This was it was something from the 12th grade, so that we are together. So this is high school, and so this is also something that never bothered me anymore, because I'm always very happy in that part. So it doesn't occupy any of my thoughts, So it's great. I
Love
have
that.
other time. No, it's true.
Yeah, I love it.
I'm very happy. My husband is beautiful. We do everything together in terms of sports, surfing, skiing. So we are always pushing each other in terms of that. He helps me in a lot of things. He's the one with all the organization. So I am the social organizer. I organize our social life, and he takes care of the bills and everything. That's
My husband was in the Marine Corps for 10 years. So he does all the laundry, all the cooking, the dishes, and it's like perfectly done all the
perfect. You see?
time. So I'm like, that's
No,
my secret.
And Julianne has 3 girls as well, so you definitely have that in common, and the girls, and I have 1 daughter, so I know how that goes, and 1 son as well, but,
Yeah, for
that's
sure.
incredible that, again, you can be this elite dentist, lecturer, trainer, but then have, like I said, a great home life and family life and enjoy surfing and all the other
yeah.
activities you do,
The
and
kids, the kids help me all a lot. So they are very comprehensive. Sometimes I get to take them with me in some of the which they also love. So some of the lecture strips that I have, which that is also amazing for them. And I think in terms of sports, the surfing the ocean, I have to go to nature every time I can. That's also where I regain my energy. So this is very important, be it in the ocean, being it in the mountains or in the forest. It's very, very important. And when I do that, and usually I do all these activities among with friends and the people that I love, my husband and my kids also, they also surf, they also go with me. So that's out of it, because you get energized and you think about other things,
I'm
and it's amazing.
curious, do you have some incredible books, authors, or a sort of guru type of people that you've looked up to? And there's like people who inspire us with their quotes, their philosophies, and I'm just curious if you have any of that.
Yes, I think there are many authors. I was like looking at what I have here, just in the but Robin Sharma is for me one of the authors that have been that helped me a lot. So I think that what I have here. I don't know. For example, Eckhart Tolle is good.
Love Eckhart Tolle. What about I
Yes.
like you? You made me think of like Ralph Waldo Emerson or somebody like that because of your nature comments, right? But yeah, Eckhart Tolle is amazing. And so, are
Mhm.
you? How much do you utilize like the power of now in your life? Are you all about presence and being completely, in the moment? I'm curious.
No, I think I try not to be in the past. So for me, the past is the past. I try to learn from the past, and I learn, but don't get stuck in the past. I live a lot the now, but always thinking also about the future, making plans for the future. Okay. So I'm not saving with all the savings for when I retire and then spend. No, I have to plan my retirement, and I have to plan the future, for example, and I plan the future in all of this, not with everything in life, I'm just giving an example, but I like to consciously live well the now, the present time, always. It's the most important one. It's for me, is the most important one. But again, these requests for me a lot of work that you have always to be conscious. And in that sense, I think for me, sports help me a lot. The sports help me a lot because I think that my mind is thinks a lot. Women, we always have this. I don't know, me myself. And when you do all sports, as your body gets a little bit more tired, it calms a lot your mind and makes you to be in the now. So for me, that helps me a lot.
Mike, what are you thinking
yeah.
right now? I can
No,
see
it's
Mike
good.
is like,
No, I'm just enjoying the conversation because I agree with you, and I agree with living in the now because nothing's promised you in the future. And obviously, we love our memories and we love what we have done. But I am starting to do that more and more in my life as well to live in joy when you're at a conference or with college or with people. Like when we last saw each other in Las Vegas at the symposium, it was nice to see people, to hear lectures. I went to your lecture with the other very prominent women in dentistry, and that was an excellent lecture about talking about mentoring and empowering women. But then on the other hand, you can joke, you can laugh, and you can go out and have a good meal. And so I do think conferences like that, where you can talk about what you've done or what you're currently doing, and then talk about the future. So I think to live in all those spaces is very important. So thank you for sharing that with our audience, because I think too many dentists, and we see it, a lot of dental burnout, a lot of
Yeah.
doctors breaking down, having all kinds of issues with their teams, with their family life, and so on. And Julianne speaks wonderfully on that, and I've heard her many times as well. But you should enjoy your hard work. You should enjoy your friends and family, and not take anything for granted. So thank you for sharing that. Julianne, do you want to talk a little bit
Well,
about that and that mindset?
yeah, I just so I always think it's interesting. So we kind of started this episode out talking about your sort of energy that you have a life force energy that just exudes, never ending source. And so you wonder like what makes somebody an energizer buddy where it doesn't wear out. And you can see a lot of that is philosophical, right? Because I think that we have a renewable resource of energy and our body can, even as we get older, can keep going. But I do think that there are some conscious things that people do who have that. And it's not everybody, it's more like 1 out of 10 who really live their lives with that much energy. And it is foundationally built on top of something, purpose or commitment or just constant gratitude or a variety. I think very much a variety of things. So my curiosity is if you were to try to package it and say what it is, because you have it, you do it naturally, probably even sometimes without realizing it. But what would you say to somebody who can't find their own passion, purpose, or why? Because there are people out there, they're struggling right now with that type of thing. And, I'm just curious.
That is a good question. I don't know because I think that the most interesting that I have realized is that everything is in you, which means what do I mean by this? This is maybe strange to say, but it's like everybody can do everything to you, but only you are in a possession on your reaction. Only you are going to react or let it inside you.
What you would say to someone who is struggling that doesn't have a purpose or doesn't know their way? Because you see that all the time. We see these just amazing, it doesn't matter age, but clinicians that are very clinically sound, but they don't know how to work within a team, or they don't know how to communicate with patients, or they don't have the confidence in themselves, right? They're very smart academically, but maybe they're not the best surgeon or something. But
Yeah, but, like I always say, I think that it's uh, that you have to constantly work on yourself, because uh, sometimes we are just waiting for the answers to be outside ourselves, and everything is actually inside ourselves. So we
right.
are actually trying always to have the approval of the outside world, and basically the approval that you need is from yourself.
What I wanted to chime in really quickly, Dr. Ferro, on what you were talking about is it reminds
Yeah,
very it reminds me very much of philosophically what Mike and I believe, which is that you have to take full responsibility for your own choices. And at the end of the
yeah.
day, nobody else, everybody is operating with their own story or their own meaning to everything coming from their own childhood, their own identity, their own upbringing, their own traumas, all these different things that cause people to think and perceive things a certain way, right? And at the end of the day, the only ownership we have is over our own perception and our own way of interpreting everything. And so I completely agree with you that I believe when you understand that, then what happens is we begin to have the option to choose the beliefs and or the meaning that is most empowering rather than beliefs or meanings or stories that we tell ourselves around what might not empower us. So we choose to interpret things as good rather than bad. And we pick those things that will help support people around us and ourselves rather than making up some story that makes us feel like we're entitled or like sorry for ourselves or something, because that's not going to help you to grow and live a very meaningful life. Yeah. So I love what you're saying. And I love that you look at it that way. Did I interpret what you were saying fairly well?
No, it's perfect. It's perfect because I think the your constant work that has to be your inner work, it has to be the work on yourself, because also the way I feel now and my my beliefs now are completely different from how they were 10 years ago. So this is something that I have constantly to be working on, because, and like I was saying to Michael, I think people are always trying to get the approval from the others and from the outside world, and has that approval would bring me joy, but it's completely the opposite. You have to have your own approval to have all the joy. If you have that, it doesn't matter if the others don't approve. If you have that, you are good. So that's what you have to work every day. It's on yourself.
I love
That's
that.
my
And I fully agree. And it's not coming from a selfish place, because we can take a
no.
look at how
It's the
you live your
opposite.
life. Yeah, it's the opposite.
Yes.
It's actually very generous, because if we are good, we can then lift others up and we can be an inspiration for others. And if we're not, then all we're going to do is be that person who provides evidence for what so many people are already experiencing, which is that, oh, everything's terrible, and in fact, everything is amazing, but it does take an active process of choosing how you look at things. And I believe that the natural state, we tend to default to negative, but when we practice being positive and looking for good, then you start to see it everywhere and it becomes a no-brainer. That's the only way you want to live. And because it's almost like working out a muscle.
I'm going to tell you when I when I got conscious of this, when I became a mother and I had my first kid. And many times, not so many, but sometimes I would go out with my friends and leave my daughter with I don't know, one of my cousins or someone babysitting her. And every time, or that I was more stressed, or I was in a rush, or that was the time that I would get always late, because then she would start to cry, that she would try or I had to feed her again, or I had to change the diapers, or I had to something, they felt this. When I was completely perfect with no rush, everything would go smoothly. So I'll realize, okay, I have to be good with myself to be well for the others and for the others to accept. And this is very, maybe for you it doesn't mean anything, but for me that was a big eye opener, because you tend to be very mechanically like, okay, you feed, you change the diaper, you do this, you did this. That's the receipt. I go, this is a type. No, life is not like that. Everybody sense, everybody has feelings, everybody sense, and the energies don't go like that. So you really have to be good with yourself to be able to be there for the others. And that's exactly what I learned with my
I
first kid.
love that, because I think it's true with your spouse. I think it's true with your children. My husband and I, we get along really well. And I think it's because we honor each other so much. So we take care of ourselves. And we always kind of kid around that it's not 50-50, it's 100-100. Like, take care of yourself. And then everything that overflows gets to go to the other person. And, and you're going to ebb and flow with humans around you, right? And you have good days and you
Yeah.
have bad days. But if you can focus on yourself and then you're good, you tolerate everything else so much more easily. I love it. This is all so in alignment with how I look at it. And it's not because it's in alignment that I'm loving it, but it's because it really works, right? Mike,
Yeah.
you're going through the same sort of journey, right? We're all experiencing this right now.
Yeah, no, 100%. It's not just inherent to your work environment or your personal environment. It's life, right? It
Yeah.
intertwines, and how you are at work is going to be how you're at home, and vice versa. And that's why it's good to be at peace with all of it, and to find that solace, like you said, whether it's surfing on a wave or working out or going for a walk or reading a book, whatever you do. But we all need balance. We need solace. We need like-minded people around us. And I guess I know we're going to be wrapping up here shortly, but other types of people that kind of think the same way, are influential, that kind of have the same thing. It's good to learn from others and types, but I think we also gain energy for people who kind of have the same philosophies as us, and that can build and build and build. And that's why I gain energy, and why I like, talking with you, Anna, and spending time, is because I do, like Julian was saying, hear and feel that energy. And I see the work and the great work you do in dentistry clinically, but also, off clinically, when you're talking to peers and colleagues about mentoring, and about exactly what you said about finding that balance, and taking care of yourself. Because in dentistry can't just be pure clinical. It has to have all the other skill sets to
Yeah.
succeed, not only for you as an individual, but for your teams, because you have the best clinical assistant or best clinical hygienist or whatever. But again, unless they're working together in harmony and see the common vision that you have, you're not going to get there, and the patient isn't going to get that experience that they deserve.
Yeah, and I would just add, we definitely need to wrap up and be mindful of everyone's time, but I want to give you an opportunity to give a shout out to, your team and how people would contact you if they wanted to come and train with you, and then get some last words of wisdom before we wrap up in terms of, what you might leave with this amazing dental community who is tuning in to hear the stories about people's success, what they've overcome, what their secrets are. You've given us so much good stuff in this podcast. I'm so grateful. But just how can people reach you? How can people get involved with Malo Clinic? And also then we'll let you give us some last words of wisdom.
Yeah. So first of all, we are based in Lisbon, Portugal. We give a lot of courses, basically in a monthly basis. So if anyone wants to contact us, wants to join here at the clinic for a week or for some days, you can always go to the Malo Clinic Education website. You can also follow us on the Instagram. Also, you can follow also me on the Instagram, which is dot who, and you can follow me. So if you need any information, or if you want us to mentor, or if you want to share a case, well, feel free to do that. And well, shout out to the dentistry community, the ones who are starting or the ones who are already doing for a long time. Is that basically we are living now in a world that you don't need to feel alone. You are not alone. We are able to help each other. We are in a distance of a click. So if you need any help, if you need any support, reach some mentors, reach people that also can help you, but also can inspire you for you to become not only a better dentist, but also a better person. And I know how patients can be. So be patient also, and always look at yourself and try to always try to grow yourself, not only in terms of technically, but also and especially in terms of your inner wisdom. So please, if you need anything, contact me also. Thank you guys for having me here.
It's been such a pleasure. So just really quickly for Instagram, it's Dr. Anna, ANA, Ferro, FERRO, correct? Did we get that right?
Yes.
Okay,
Yes.
amazing. And then you can find Mike and myself at Influential Dental, just like it sounds. And it's just been so much fun having you on this show. And I think people are going to take away so many incredible words of wisdom out of this. Thank you so very, very
Thank
much.
you.
Your time is so valuable, and we are forever grateful. So thank you.
No,
Thank you
thank
very
you
much,
for
Dr.
having
Ferro.
me.
All right, take care. Thank you.